Let's now begin with the misplaced priorities charge that seems like an understatement when it comes to Karnataka, as there are a lot of stories that are going against the government under Siddaramaiah. They now are facing backlash over the last few days for prioritizing swanky junkets, handing out cabinet posts, and not to forget the luxurious recliners at the Vidhana Soda. While the Netas enjoy comfort, it's the citizens of Karnataka who are left to suffer. Traffic woes, pothole-riddled roads have become an everyday tale, but it is the health care service in Karnataka that has now faced a setback, as free MRI and CT scan facilities have abruptly been suspended at the Dharwad District Hospital in the state. The agency providing these services cited non-reimbursement of significant outstanding dues under the ABRK scheme as the reason for halting these services. So remember, this is another growing concern, and this is directly going to be impacting the citizens of this state, and how healthcare is going to see a massive setback. These are free MRI, CT scan services that were provided at the Dharwad in fact, government hospital, that district hospital. That service now stands suspended. In fact, the agency that was providing these services in the past has explicitly spoken about non-reimbursement of an amount which is rather significant, a due that is pending under the ABRK scheme, and that is the reason why they cannot go ahead and provide any more free MRI and CT scan services. And this is what is coming out as far as that company is concerned. So it's not just the dues that remain outstanding as far as the contractors are concerned. We've had a sitting minister who's gone on record and who said that it's a constant issue, it's a legacy problem, and that's why it will take time before something can be done about it. But even while the Siddaramaiah administration continues to talk about the kind of time that they need to fix the wrongs that have been going on in Karnataka for over the years, what about these luxuries that they in fact are giving out, doling out to their MLAs? Whether it is these reclining chairs, very luxurious setups at the Vidhan Soda, luxury junkets going to New Zealand and Australia. 20 of the MLAs have recently left for this alleged study tour to these foreign locations. All of that is being done, and that also involves money. While they do not have time to pay the pending dues, whether it is the contractors, but in this case, a priority health care that should take precedence over anything else in the state, that has in fact taken a back seat. There are these free MRI and CT scan services that were given out at the Dharwad District Hospital that now stands suspended because of alleged non-payment of dues. Let's take a look at reactions coming in.
Sir, we've seen multiple reports of MRI scan and CT scans being stopped at multiple places in district hospitals. The government says that these bills are disputed and it hasn't been accepted by the department since 2019. What's the crux of the matter, sir?
See, they are making some claims which we are saying is not valid. And I'll be giving actually a detailed response on today 5 o'clock, where we found many discrepancies also, and which we tried to take corrective measures in 2024. And we brought about changes in the system, which has actually drastically reduced the expenditure that was happening prior to that, when the scans were being taken. So that apart. So we were asked for certain verifications, and certain things that they're claiming since 2019 onwards, retrospectively, payments have to be paid with an annual increase of 5%, which we are not agreeing. So this is the situation. Now, they have a problem, but if they're going to be stopping services like this is completely, not acceptable. But we have made alternate arrangements in all those places. I think by tomorrow, there's 13 places where not entire Karnataka, only 13 districts where they are running. We are making alternate arrangements. Already it's been made in most places. So people should not suffer, or people should not have any hardship. But with them, it is a dispute, we can say. And what is admissible to us, because it is public money, we cannot just make payments, and especially after we have found certain things are not correct, and we corrected the system also. And certain things that they're claiming, we're saying that is not, given by the previous government also, they didn't accept it. There was 3 years BJP rule. I know Mr. Ashok and all have made a big statement. But even in their rule, they didn't give that money to them. So they are accumulated all that money and said, now you have to give us 140, which we said we cannot give. So whatever we can give, there's no money problem for us. Even though NHM money has not come to us, but I'm not politicizing that part. Government of India still has to give a lot of money to us. But that will come eventually. If not today, it will come maybe next month or maybe even by April also. I'm not disputing because this is public health issue. So state government is willing to pay the money. But we will pay what is, according to us, the genuine payment that needs to be made. Now, if Mr. Ashok and BJP wants us to give the private company how much ever they are asking, and that we can be blackmailed, we won't be blackmailed. Okay? And we will make alternate arrangements. So tomorrow, if the issue settles, good. Otherwise, we'll see what else to do in the future. But public, even if they come back tomorrow and start functioning, the alternate arrangements will not be removed.
Okay.
Because tomorrow they may do it again. So whatever alternate arrangements that have been made now, we will make it a permanent thing. So the public can either take it from them or go anywhere else also. Because they have now stopped the services. So we are now, when we make alternate arrangements for people, that will also become a permanent fixture now.
So the other aspect that has garnered a lot of focus is Mr. Satish Arkyoli's statement saying that commission is something that's existed before Congress came. It's now, it'll be there.
See, now, Mr. Satish Arkyoli has only stated which everybody knows. Corruption is there in the system. It's not party-centric or time.
Now take this across to my colleague Harish Upadhyay, who joins us live on the broadcast. Harish, you have in fact spoken to the health minister there in the state. He is talking about some amount of discrepancy with the claims that this private player seems to be making. And then he also suggests that the previous government, the BJP government in Karnataka, also did not see it, did not deem fit for those payments to be made. Is there a way to, in fact, go ahead and corroborate these claims that the Congress party now seems to be making with this company that has refused to provide these services anymore?
Yes, one thing is very clear. These bills are from 2019 and some of them have been disputed. In fact, the entire 143 crore rupees that's now being disputed is starting from 2019 and multiple bills. The argument here is that this company has been seeking a 5% increase every year, which is unacceptable. It's not part of the contract, is what the government is saying. Second, remember, the BJP was in power between 2019 and 23, and even during those times, this entire bill has been disputed, or a quantum of it has been disputed, and all of it has now totaled to 143 odd crore rupees. That's what the government is saying. The other aspect here the government is making very clear is that they can't be held to ransom. They can't be blackmailed by a diagnostic firm operating in 13 districts, and they're putting in alternate mechanisms in place, and the government making it very clear that this will continue irrespective of whether the services that they have currently with this firm continues or not. These alternate arrangements will be there in place to ensure that a private firm can't really blackmail the government, especially on such a sensitive and a crucial issue of health and also diagnostic services. And they are saying this has affected people. We have put in alternate measures that will continue, and even in the meanwhile we will not yield to this pressure and give away public money just because one company feels that they should be paid 143 crore rupees more than what they've been paid for so far.
Wait, Harish, you mentioned that this particular diagnostic firm was functional in 13 districts, including Dharwad. So far, the problem has been cited out of the Dharwad district hospital. Have there more reports that have now emerged of they shutting down their services, and very, very critical ones, MRI and CT scan, in other district hospitals as well?
Absolutely. 13 different hospitals or places where they are operating, including Gadag, Dharwad, Haveri, various other places. And in all these places, what the government has done is they've ensured that the services, diagnostic services in the local colleges, medical colleges there and other hospitals is thrown open for these patients at the same rate that they would pay earlier and at the same cover that they would get under ARKB and all the other allied services, and they do not have to shell out anything extra.
Okay, but is it operational now? These services, these alternate arrangements that the government is talking about, which Mr. Gundu Rao was also talking about, is it operational, considering they were freely given to the people in these district hospitals by this earlier player?
Well, it's been made operationalized in certain districts already. Some of them are yet to happen. There are a couple of issues in terms of the back-end integration and also ensuring that there is a seamless patient transfer that happens. Because remember, not in every district do you have the district government hospital and these medical colleges in the near vicinity. That's one. Second, they'll also have to ensure that the paperwork is done properly. So that is something that the government is hoping can be done and put in place by the end of tomorrow, and patients do not suffer. In certain places, they are saying already this mechanism has been implemented.
Right, Harish. We've already heard from the Congress party, particularly from the health minister there in the state of Karnataka, but he's also citing the reactions that are coming in from the Bharatiya Janata Party. Leaders like Mr. R. Ashok really going on record and crying foul over this latest miss by the Congress government. But from where we are looking at things, from your conversation with the health minister, this does look like another legacy problem that Karnataka will have to brave.
Absolutely. Remember, the dispute starts in 2019, and if the government was not happy with this particular diagnostic firm seeking a 5% increase, or if they have noticed certain discrepancies in how the billing has been done, the question is, why have successive governments continued with them? Remember, BJP was there in power for 3.5 years. After that, this present Congress government has finished 2.5 years. Why is it that they continued with this firm for such long time? Couldn't they have gone for a new tender and gotten a new player or have a new contract that makes it very clear how much will they be paid for which service, how much they can they bill under different schemes of Karnataka government's health initiative? That would have ensured that this confusion doesn't arise. And second, it wouldn't have reached the situation where a firm is now stopping such a crucial service and blackmailing the government.